Did you know that simply basking in sunlight could boost your vitamin D levels and help you improve your overall health? Heliotherapy, or sunlight therapy, is the therapeutic use of sunlight to improve health and treat various medical conditions. It is one of the oldest forms of therapy, dating back to ancient times when the Greeks and Egyptians recognized the sun's healing power. In the 19th and early 20th centuries, heliotherapy gained prominence as doctors began prescribing sun exposure to treat conditions such as rickets, tuberculosis, and skin diseases. The therapy involves exposing the body to natural sunlight, which triggers a series of beneficial physiological processes. Sunlight is composed of various types of light, including ultraviolet or UV, visible, and infrared light. UV light, in particular, plays a crucial role in the production of vitamin D in the skin, which is essential for maintaining healthy bones and a robust immune system. Moreover, exposure to sunlight can stimulate the production of serotonin, a neurotransmitter associated with mood regulation, and melatonin, a hormone that regulates sleep. Heliotherapy is considered a holistic approach to health, as it leverages the natural power of sunlight to promote physical and mental well-being. By understanding and harnessing these effects, heliotherapy offers a natural, accessible way to support overall health. What is the history of heliotherapy? Heliotherapy, or sunlight therapy, has a rich history that spans across cultures and centuries. The therapeutic use of sunlight dates back to ancient civilizations, where it was considered a powerful healing tool. In ancient Greece, heliotherapy was embraced as part of a holistic approach to health. Greek physician Hippocrates, often referred to as the father of medicine, recognized the sun's therapeutic potential and prescribed sunbathing to treat various ailments. The Romans also utilized heliotherapy in their health practices. They built solariums, or sunrooms, designed to capture the sun's rays for therapeutic purposes. The Romans believed that sunlight could help strengthen the body and promote vitality. In ancient Egypt, sunlight was revered for its healing properties and was often associated with the sun god Ra. Egyptians used sun exposure as a remedy for skin diseases and to enhance overall health. The early 20th century marked a resurgence of interest in heliotherapy, particularly for treating tuberculosis. Dr. Auguste Rollier, a Swiss physician, became a prominent advocate for sunlight therapy, establishing sun sanatoriums in the Swiss Alps. He observed significant improvements in his patients' conditions through controlled sun exposure. However, with the advent of antibiotics and modern medicine, the use of heliotherapy declined. In recent years, there has been a renewed interest in natural therapies, including heliotherapy, as people seek holistic approaches to health and wellness. Today, heliotherapy is recognized for its diverse health benefits, from improving mood to boosting vitamin D levels and supporting immune function, making it a valuable part of integrative health practices. How does heliotherapy work? Heliotherapy works by utilizing the natural energy of sunlight to stimulate biological processes in the body. When UVB rays from the sun hit the skin, they interact with a cholesterol derivative called 7-dehydrocholesterol, converting it into vitamin D3. This process significantly contributes to maintaining optimal blood vitamin D levels, crucial for calcium absorption and bone health. Additionally, vitamin D plays a pivotal role in modulating the immune system and reducing inflammation. The effects of sunlight on the brain are equally fascinating. Sun exposure increases the release of serotonin, a neurotransmitter that enhances mood and helps maintain a sense of calm and focus. Higher serotonin levels are associated with improved mood and a sense of well-being, which can help alleviate symptoms of depression and anxiety. Moreover, sunlight exposure helps regulate circadian rhythms by stimulating the production of melatonin at night, promoting better sleep. Beyond these internal processes, heliotherapy can also have direct effects on the skin. The UV light can help treat certain skin conditions, such as psoriasis and eczema, by slowing down the excessive growth of skin cells. By understanding the mechanisms of heliotherapy, we can appreciate how sunlight therapy can naturally support a range of health benefits, from boosting mood to improving immune function. How long does it take to feel the effects? The time it takes to feel the effects of heliotherapy can vary depending on individual factors such as skin type, geographic location, and the specific health condition being addressed. Generally, some benefits, like mood enhancement due to increased serotonin levels, can be noticed within a few hours to a couple of days of regular sunlight exposure. This is because sunlight stimulates serotonin production relatively quickly, contributing to improved mood and a sense of well-being. For other benefits, such as an increase in vitamin D levels or improvement in certain skin conditions, it may take several weeks of consistent exposure to notice significant changes. Vitamin D synthesis can occur within minutes of sun exposure, but reaching optimal blood levels might take longer, especially in individuals with a deficiency. When using heliotherapy for chronic conditions like inflammation or immune support, a consistent exposure schedule over several weeks to months is often recommended to achieve noticeable effects. It's important to remember that moderation is key to avoiding potential skin damage, so balancing sun exposure with protective measures is essential. Effects on vitamin D levels? Heliotherapy is highly effective in boosting blood vitamin D levels, an essential nutrient that plays a vital role in bone health, immune function, and overall well-being. When UVB rays from the sun penetrate the skin, they convert 7-dehydrocholesterol, a compound present in the skin, into vitamin D3. This process occurs rapidly and is the primary natural source of vitamin D for most people. Vitamin D is crucial for calcium and phosphorus absorption in the gut, which are essential for maintaining strong bones and preventing conditions like osteoporosis and rickets. Additionally, adequate vitamin D levels are associated with a lower risk of autoimmune diseases, improved cardiovascular health, and enhanced immune response. Regular controlled exposure to sun can help maintain optimal vitamin D levels. However, it's important to balance sun exposure with skin protection to avoid potential harm from UV radiation. For those living in regions with limited sunlight, supplementation might be necessary to achieve sufficient vitamin D levels. Does it have side effects? While heliotherapy offers numerous benefits, it has potential side effects, particularly when exposure to sunlight is excessive or unprotected. The most well-known risk associated with sunlight exposure is skin damage, including sunburn and increased risk of skin cancer due to ultraviolet radiation. Prolonged and unprotected exposure to UV rays can cause premature aging of the skin, characterized by wrinkles and age spots. For individuals with photosensitivity or certain medical conditions, sunlight exposure may trigger adverse reactions such as rashes or exacerbation of skin conditions. It's crucial to consider your skin type and health status when engaging in heliotherapy to minimize these risks. To reduce the potential side effects, it's advisable to limit sun exposure to safe periods, such as early morning or late afternoon, and to use mineral sunscreen or protective clothing during peak sunlight hours. By practicing sun safety and moderation, individuals can enjoy the benefits of heliotherapy while minimizing potential risks. In conclusion, and to summarize today's video, heliotherapy, or sunlight therapy, is a time-honored practice rooted in ancient traditions, utilizing the sun's natural energy to enhance health and treat various medical conditions. It gained prominence in the 19th and early 20th centuries when medical practitioners prescribed sun exposure to address conditions like rickets, tuberculosis, and skin diseases. The therapy leverages the benefits of sunlight, particularly its UV components, to trigger beneficial physiological processes, such as vitamin D production, serotonin synthesis, and melatonin regulation, supporting overall health and well-being. It works by using sunlight to stimulate biological processes in the body. UVB rays initiate the conversion of 7-dehydrocholesterol in the skin to vitamin D3, essential for bone health and immune function. Sun exposure also increases serotonin, a neurotransmitter that improves mood and reduces anxiety, while regulating circadian rhythms through melatonin production, promoting better sleep. Furthermore, sunlight has direct effects on skin conditions like psoriasis and eczema by decelerating skin cell growth. These mechanisms highlight heliotherapy's ability to naturally support health, from mood enhancement to immune function. The time required to feel the effects of heliotherapy varies based on individual factors. Mood enhancement, driven by increased serotonin levels, can occur within hours to days of regular sun exposure. In contrast, raising blood vitamin D levels or improving certain skin conditions might take several weeks of consistent exposure, especially in individuals with deficiencies. For chronic conditions like inflammation or immune support, several weeks to months of regular exposure may be necessary to achieve noticeable benefits. A balanced approach, ensuring moderation to prevent skin damage, is essential. Heliotherapy is highly effective in increasing blood vitamin D levels, a critical nutrient for skin, bone health, immune function, brain, heart, and others. Vitamin D facilitates calcium and phosphorus absorption, crucial for preventing osteoporosis and rickets. Additionally, adequate vitamin D levels are linked to a reduced risk of autoimmune diseases and improved cardiovascular health. Regular sunlight exposure helps maintain optimal vitamin D levels, but those in regions with limited sunlight might need supplementation. However, it has potential side effects, particularly with excessive or unprotected sun exposure. Risks include skin damage such as sunburn, premature aging, and increased skin cancer risk due to UV radiation. Individuals with photosensitivity or certain medical conditions may experience adverse reactions, including rashes or exacerbated skin conditions. Limiting exposure during peak sunlight hours and using mineral sunscreen or protective clothing is crucial to minimizing risks while enjoying heliotherapy's benefits. Thank you for tuning in to Levitas. Please share today's video with friends and family, give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated. It helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So, stay healthy, stay happy, and keep going.